Good evening and welcome to another episode of iMed. And on today's episode, the focus is on the rise of the dengue fever. And today with us, we have a subject specialist in the studio with us. That is Dr. Nimalka Pannilahetti, consultant community physician from the National Dengue Control Unit. A very good evening to you, Doctor. Welcome to iMed. Doctor, let's start off the discussion about how rapidly increasing the dengue fever in Sri Lanka is. If you look at the numbers have drastically increased if you look at the last 2 months. What is the cause for all of this, Doctor?
As you know, dengue is, it has two seasonal peaks, I would say, associated with the monsoonal rains. The first peak occurs between April to say July, associated with the southwest monsoon rains. So after a lapse of few months, again with the north east monsoonal rains, there is another peak. So even though there are two distinct peaks, the other months also have dengue cases being reported, because for the dengue to increase, there should be the mosquito which transmits the disease. So we have seen that the mosquito population is increasing with the rain. So we have observed increased reporting.
Yes, Doctor. If you look at the numbers in the month of November itself, we've had more than 4,500 cases, which is the highest number of cases reported in a month. And the December figures are quite concerning as well, because we've only had 15 days so far and we've already had 3,620 cases. Are there any other factors contributing to this apart from the monsoonal rains?
Yes, we can't say that it is solely due to monsoonal rains. We have to consider human behavior, the accumulation of breeding places in our premises where we work, and also population movements. When the people move from a low risk area to the high risk area, they get infected with the virus, and when they go back, they can spread the disease to outer areas. And also the mosquito bites mainly during morning and in the evening. So when people are exposed to the mosquitoes during that time, especially the school children, the virus can be introduced to the body through the mosquito bites via the skin. So all these factors are conducive to mosquito breeding. And I should say that our community, though they behave very with responsibility, now maybe that due to other reasons they have forgotten how they should act upon to prevent mosquito breeding. So that also has been a factor. So through media we are educating the public to behave responsibly.
Yes, Doctor, like you mentioned, I think everyone is so concerned about the COVID pandemic, they've forgotten about the dengue fever and about the communal responsibilities to keep their premises clean. And we've seen that over the years, dengue has been a silent killer that has taken so many Sri Lankan lives. Now, you mentioned a bit about high-risk areas. If we take the Sri Lankan geography, what are the areas that has the highest risk, Doctor?
The highly populous area, for example, if I mention the districts, Colombo district, Gampaha, Kalutara, and also now we have seen cases, patients coming up from Kurunagal district and Puttalam district. And earlier, at the beginning of this year, we had a lot of cases being reported from Betikalo. That is also associated with northeast monsoonal rains. So in emerging dengue cases, we can't say that it is there are no districts that we can spare. All the districts report dengue patients, but because of this multiplication of breeding places and population movements, Colombo, rather Western Province, report as of now about 60% of the total cases that are reported for this year. So and emergence of lot of construction sites, that is also one reason for which is conducive for mosquito breeding. We all know that this mosquito breeds in water collections. So there is multiple containers around. So that is also one reason.
And Doctor, if I may ask, what are the actions taken by the dengue prevention unit in order to look at people who are not adhering to the health and safety guidelines? Is the action being taken right now?
There is legal provision for those who harbor breeding places inside or outside their premises, but we most of the time we resort to health education and behavior change by giving knowledge, because we have seen that people once they acquire knowledge and understand, they are motivated to adopt good behavior, especially school children. Sometimes we educate school children to take the message across to the parents. As you say, there is community negligence, because prevention of dengue is individual responsibility as well as it is a community responsibility. If we spend about 30 minutes at least every week to look for the breeding places and then clean our premises, clean the premises of our child where he is educated, and to clean the area where clean the our office and the religious places, all these have some kind of breeding places. So actually we don't resolve much to dengue this legal provisions, because as the last resort there are examples that we take legal actions.
Doctor, with the COVID pandemic engulfing the entire world, especially even in Sri Lanka, the impact is very high. And if we talk about dengue, and if you look at COVID also, there are symptoms that might be common. So what would be the best way to identify that you have dengue? What are the distinct symptoms that can be easily identified?
Yes, in dengue and COVID, in both diseases, fever is the first symptom. So it is really a practical issue as to which is the disease and when and where to seek medical advice. In the case of COVID, the symptoms are mainly respiratory, the sneezing, sore throat, and shortness of breath, and that sort of things. But in dengue, it is the fever, high fever, coming with nausea, vomiting, body aches and pains, and there may be a history of COVID patient in the situation of COVID. So initially, since the symptoms are subtle, there are subtle differences. In dengue, we have to we are telling the community, we are educating them to seek medical advice on the second day of fever. Then with the full blood count and NS1 antigen test, we can confirm or suspect whether it is dengue. So it is easier to diagnose if it is so dengue earlier, because if it is I have to say here that even if the NS1 test is negative, that does not exclude dengue, because minority of patients can have negative NS1 test even with dengue. But if it is positive, we have to consider that this patient is a dengue patient. So if it is if the person has respiratory symptoms, we can diagnose by rapid test or PCR test. So it is very much important that patients are coming to the hospital if dengue is suspected.
And doctor, we know that dengue can turn from a slight fever into a fatality. We know how fatal dengue fever can be. Now, especially with dengue fever, how important is it to identify this at an early stage? And also, if this prolongs, and can it exacerbate into different stages?
Yes, it could. Dengue, of course, it starts as a viral fever. There are it is a spectrum of disease. There are simple viral fever. The presentation looks like a simple viral fever, or classical dengue fever, or dengue hemorrhagic fever. So initially, in the initial stages, the symptoms are the same. So that is why we recommend to get a full blood count and NS1 test on the second day of fever. Sometimes even with the even if it is dengue fever, the patients will recover on its own if it is dengue fever. But some patients, they later when the fever subsides, they develop the leaking stage that you talk of. That is the exacerbation of a very serious condition where the blood in the blood compartment in the blood vessels start leaking. So it is called dengue hemorrhagic fever. So it is really a situation where the patient has to be admitted to the hospital.
And doctor, if we look at the Sri Lankan context, we know especially with different illnesses, most Sri Lankan parents, I would say, prefer to treat their kids at home. They think a household solution might be a solution that can actually work. So even with especially like fever, they tend to resort to these household solutions. So what is the impact of that, especially when we consider something like dengue?
Dengue, of course, we have seen this tendency. Those days, mothers would like to keep the children at home and give home remedies. And as I mentioned, the issue in dengue is that in later days it could be hemorrhagic. So what happens is that the plasma volume inside the blood compartment will be reduced due to leaking, and the circulation will be insufficient to perfuse the important organs like kidneys, heart, brain and so on, liver and so on. So when we analyze the deaths, we have seen that since the patients were treated at home without replacing the lost fluid, they have succumbed to death. So now you know that as we all know that in an adult person we have about 5 liters of blood in our blood circulation. So when the plasma starts leaking, since the blood supply to the vital organs get impaired, the patients will die of shock because of the failure of vital organs to function. So that is why we don't recommend home treatment unless the persons are improving in the initial days. So to assess that, we recommend full blood count test in the second day of fever, and to see whether the platelets is coming down, and if it is coming down, we do serial tests to see whether they are improving.
Yes, so this is to all the mothers out there who believe that Kottamali might be the solution for everything. It might not, especially during this season. You need to be careful of the dengue fever, and rightly, like doctor mentioned, it is important to go out there and get tested if you have viral fever. So with that, doctor, we spoke about the symptoms, we talked about the kind of remedies that are available, the courses of action you need to take at detection of the symptoms. Let's also talk about prevention of dengue. As individuals, what can we do? How do we play our part in making sure to make endeavors to prevent this dengue menace?
Yes, dengue prevention is like two sides of the coin. In one side, we have to prevent the transmission, spread of dengue. To do that, we have to prevent the mosquito from getting the virus from the patient. When somebody has fever in dengue for about say 5 to 7 days, the virus also lives in that patient. So during that time, if a mosquito bites the dengue patient, the virus enters into the mosquito's body. So we have to prevent that also. That is why we recommend patients to sleep under a bed net to prevent the mosquito from getting the virus. The other aspect is we have to prevent the breeding of mosquitoes. To do that, we have to eliminate all the possible breeding places, potential breeding places. We have to keep our roof gutters, our drainage, gullies and water storage tanks, all the things protected from entering mosquitoes. Sometimes we have seen that inside also there are water tanks, outside the house also water tanks open, which are not cared by the occupants. So at least once a week we have to spend our time, because the mosquito life cycle takes about 1 month for the completion from egg to the adult, emergence of the adult. The other thing is that there is one aspect for those places that we cannot eliminate. We have to put some kind of chemicals to kill the larvae, in consultation with the medical officer of health in the area. Apart from that, if someone gets fever due to somebody's fault, the mothers or the responsible citizens, they have to go to a doctor for medical advice, and if it is I mean, initially all the patients may not be needed to admit the hospital, but when they are cared at home, we can have bed rest, and also some digestible food like sufficient amount of food, and also fluid like kanji, jeevani, fruit juices and so on, because sometimes if they are continuously vomiting and not taking adequate fluid inside, they could be dehydrated, and also if plasma start leaking, the blood volume will be still low. So proper getting to a medical doctor in time is also very important, rather than staying at home. Sometimes our community's fear of getting admitted to hospital, since they think that they might catch COVID in the hospital. So it is not so now. We treat them separately and in a very safe manner. So their fluid is monitored, fluid intake is monitored, all the care is being done. If they come to the hospital at the correct time, if they wait at their homes until the fluid starts leaking, the organs might suffer, the vital organs like kidneys, livers. So they have to come to the hospital so that the fluid can be replaced well in the hospital in time.
Thank you very much, Doctor, for educating our viewers on the best courses of action. But since we spoke about prevention, since we've heard that the dengue mosquito is nocturnal, not nocturnal, it's active during the day. So has that changed over the years? Do we have cases being reported where the infected were maybe bitten during night time as well? Have things changed?
Actually, based on the studies and research, the most of the time we have seen that it is a day bite. Mainly in the mornings, from say 6 to 11 a.m. in the morning, and also in the evening, because this doesn't like sunny weather. So but if our home conditions mimic the dim light and the cool environment even during the hot time, so it could bite, because it needs the blood for the maturation of eggs. Only the female mosquito bites. So that is why we always recommend repellents and these long garments for the children, so that the mosquitoes would not bite them. And so it is important that our windows and our shutters are kept to prevent mosquito entry in the morning and mainly in the evenings, and also when children play outside, it is always important that they are protected with the mosquito repellent, safe one. Yeah.
And doctor, let's also talk about the aftermath of being a dengue patient. Are there any effects that last longer? Are there any precautions you should take, like not working out, lifting heavy objects? What are the recommendations for someone who has just had dengue and recovered?
Yes, dengue, of course, it's a viral disease, and it causes a lot of body aches and pains. And if someone has got just simple dengue fever, there is no organ involvement much. But if someone has suffered leaking and then recovered, so I would say that both need some days of rest at home. In dengue hemorrhagic fever, which is the more concern, these people are generally given 2 weeks leave, medical leave after their discharge, and they can they don't have to refrain from taking special meals, but they need a rest. And also the important thing is that they can be reinfected sometimes later, because we know that there are 4 types of dengue viruses. If someone gets dengue due to one particular virus, the protective antibodies will be produced for that specific virus only. So, other tree can infect through mosquito bites later. So, we all know that with the subsequent infections, the complications might come commonly. So, it is very much important that in long run they get they do not get reinfected again. So, apart from that, and having rest for about 2 weeks, they can get involved in their routine activities.
And doctor, what are the recommendations, especially when it considers the diet? Is there anything that would actually help a dengue patient right after infection?
In dengue, most of the patients have loss of appetite, and some can have abdominal pain and also vomiting, frequent vomiting. So, we recommend easily digestible meal, light meal, and also sufficient amount of fluid in frequent small amounts. We do not recommend water only, because we recommend fruit juices and kanji and other nourishing fluids, because those fluids give glucose and also other minerals required for body. And regarding the solid meals, we do not generally recommend oily fatty meals, but and also red colored ones, because in case the patient vomits, we do not know whether the vomiters contain red stuff due to leaking blood inside the stomach or due to the food color of the food item. So, we generally recommend light diet, easily digestible, with for an adult about 2 liters of liquid diet in small amounts frequently.
Doctor, just a follow-up question on what you just said. We hear that a lot of people tell us that it's good to have papaya when you have dengue, that it helps your platelet count go up and all of that. But based on what you just said, I think papaya, which is closer to red, that dark orange red color, is it not recommended to have papaya when you have dengue?
Yes, papaya is not recommended as a medicine, because it may have an effect, because we can't deny or accept it unless there are wide scale clinical trials. But papaya being given mainly to increase the platelets is not recommended, because in dengue, though platelet is reduced due to the bone marrow suppression by the virus, by giving additional platelets and not other factors being improved, we can't judge the progress of the disease. Because even though platelet is given, there are other changes in the body, like leaking. Leaking is not stopped by papaya. So, when we give artificial items, we can't monitor the progress of the patient. So, it is important that without scientific researches, that these things are not prescribed. That's as a medical person, that is my general advice. Yeah.
And doctor, on an ending note, you have the opportunity to give our audience, our viewers, a message on how we as citizens have a responsibility to stop the spread of dengue.
Yes, we all as citizens can stop dengue if we are very cautious. There is our responsibility, and our behavior should be such that dengue mosquito breeding is zero in our surrounding areas. We can do that in with our day-to-day practice by allocating additional time, and with some scrutiny we can remove all the possible wet containers, dry containers, and other all the potential breeding places. And as the responsible people, when there is someone in our family or our institution with fever, we have to follow the medical advice and take to the doctor, get medical advice, and also get blood tested. And if it is diagnosed as dengue, we can do serial testing and see whether the patient is developing serious complications, or whether the patient is recovering from the illness. And it is not it is nothing to fear about, that dengue is not I mean it is those days some had believes that it is, if someone gets dengue it is not curable and so on. It is 100% curable if the person seek medical advice and gets admitted to the hospital for the replacement of fluid if the person starts leaking. So, and if someone in the family gets fever due to dengue, we have to be very much vigilant to see whether there are breeding places, common breeding places inside or outside the working place or in the resident area. We have seen sometimes one member comes with dengue, again a few days later another person comes with dengue. So, that means there is a common source in the household. So, we all have to think of prevention of mosquito breeding as well as seeking treatment in proper time. One other important thing is that we have seen that some persons buy drugs over the counter to reduce fever. That is not recommended at all, because only paracetamol in correct dose should be taken to reduce fever, in addition to other supportive therapies like being under a fan or tepid sponging and those things. Sometimes our mothers are very much keen when the child has fever, and because when the virus is inside the body, when the virus multiplies, the body we get fever. So, we have to give supportive therapy like adequate fluid and this keeping the armpits and this those area wet with some kind of cloth soaked in lukewarm water, not cold water, lukewarm water. Those are the supportive therapies. And we have seen many patients buy some drugs like these painkillers to reduce the fever fast. So, we have seen that those people get this blood, what do we call it, stomach bleeding also, because dengue we know it has bleeding. So, we augment bleeding by taking additional drugs like those painkillers.
Right. Like doctor mentioned, it is important to take the right action at the right time. So, today we were in conversation with Dr. Nimalka Panilahetti, consultant community physician from the National Dengue Control Unit. Thank you very much, doctor, for educating our viewers on the importance of taking the right action at the right time and on how to combat the dengue virus, and also importantly the best courses of action we all need to follow. And on a final note, it is important that we all as citizens of Sri Lanka do our part, clean our premises and stop the breeding to stop the bleeding. Thank you very much and stay tuned with iMed. Good night.